Hi there. My name is Kathryn Thomas, and I am really excited that you have chosen to spend the next 30 or so minutes with me learning ways that you can decrease your own pain, increase your own mood, and decrease your own stress. So what we're going to end up doing today is learning yoga and breathing techniques to assist both patients and caregivers. We are very, very thankful to PAMI and to the Florida Blue Foundation for allowing us this opportunity to share innovative pain techniques and care ideas through an increased awareness both from provider and from patient. We are very honored to be a Florida Blue Foundation grant recipient through the Gateway Foundation, and we're very proud of the way that we've been able to expand both our services and our impact throughout the last couple of years. My name is Kathryn Thomas. I am I'm a veteran and an executive director of the organization Yoga for Change. And I founded the organization because of my own personal experiences. As a veteran, I do deal now with chronic pain, and I'm a military sexual trauma survivor, so I deal with PTSD. So I understand physical trauma and mental emotional trauma. And that is why I started the organization in 2014, to allow us to expand our services proven to help individuals who've experienced trauma, specifically veterans, incarcerated individuals, individuals struggling with their mental health, and youth. So when you think about us inserting ourselves into larger, proven organizations to serve our end user or clients. So for veterans, think that we work with organizations like Wounded Warrior Project or the VA or different support groups for veterans. For incarcerated individuals, currently we are, it is October 2020. And we're not offering in-person programming at this time, but what we are offering is virtual programming through specialty court systems. What that means is individuals who are in veteran court or drug court or mental health court are able to receive our services to help them elevate their participation in those specialty courts and or to allow them to get off of probation or parole early because of the participation in our program. We also bring services to youth. So think about the larger public school districts that you're aware of, or charter schools, alternative schools, after school programmings, and also Department of Juvenile Justice. And for individuals with their mental health, initially at the beginning of 2020, we were a lot more closed in that definition, specifically working with individuals in recovery. And since COVID-19 has occurred and a lot more individuals are being stuck inside their homes, are worrying about their next paycheck or when they're going to eat, or potentially not able to afford prescription drugs, we wanted to bring resources to individuals who are struggling with their mental health, because we really want to ensure that we're meeting the community need where it is, when it arises, and not just dismissing just an average person who's struggling with their depression. We want to be able to help them, even if they're not a veteran, even if they weren't incarcerated, even if they're not struggling with substance abuse. We want to help our community at large, because we know that yoga works. Me personally, I didn't start yoga until I was a little bit like after college. But I really found yoga and how it can help me with my own life after I sustained a pretty disabling injury while on deployment. And my physical therapist told me that if I implemented yoga into some aspect of my life, I could potentially see an increase in movement in my ankle, which had been broken and surgery had really hurt. And I also would be able to decrease my own back pain and deal with some emotional stuff that was going on, but also help me because I was extremely active, and because of my injuries, I became a little bit more sedentary. And so for me, I started practicing yoga just because I felt good. That feel-good feeling we as an organization wanted to define. So what we did was we worked with Boston University, thanks to the Chartrand Family Fund, and we're able to study our carceral programming, our incarcerated program, for an entire year. And that study, it was kind of divided into 3 categories. Individuals who were sentenced to our programming through the Fourth Circuit, which is now what we're really working in with the specialty court systems and the parole probation, but also individuals who are voluntary. And both of those individual groups were compared with a control group, because we were able to test individuals who were not even exposed to our programming at all, and see what sort of benefits individuals who were exposed to our programming were experiencing in comparison to individuals who were not exposed. We found across 12 validated quantitative scales and some qualitative data, what we found is we had a statistically significant impact on individuals who participated in our programming, specifically with post-traumatic growth, emotional awareness and intelligence, increased mood, decreased stress, anxiety, and decreased pain. Because for me, if you can get me a little bit less pain, you can change my life. And so that is really why I wanted to bring yoga to these larger populations, and why I specifically want to bring yoga to you today. Because even though you're in extreme pain, either mental, emotional, or physical pain, or just because you want to get a little bit more active, the idea of yoga might have a misconception in it. And so when I think, or I talk to the larger groups about yoga, I ask individuals what that is. And a lot of people talk about these very fit human beings on scenic overlooks, maybe on the top of a mountain, doing these pretzel postures or handstands. And that's yoga. But what we're going to teach today is a little bit more accessible. So no matter your physical limitations, or no matter what you're dealing with, everything we're doing today is breath work with a little bit of movement introduced. And we're going to get into that. Because how can yoga help you? Well, for me, I can just talk for me. For me, when I'm in a really high stress, toxic conversation, right? Like right now, our country is pretty divided. It's October 2020. It's on you either agree or you don't agree. And so for me, in order to really have dialogue with somebody, I need to calm my own anxieties and stressors and bodies down, and to really get rid of my fear to connect with somebody. And so for me, I have a lot of friends and family who really don't agree with me and my views. And so in order for us to discuss, I implement these tools and techniques into my daily life so that I stop judging the person and I can actually hear the person's ideas. We're going to a holiday time frame, so I really invite you to potentially think about ways that you can use these, not only to get rid of your own pain or to decrease your pain or to adjust your anxieties, but how can you utilize these breathing techniques so that you can better connect to somebody that you care about, so that we as a community can come together. And so for the first breath we're going to talk about is square breath. The reason that we use breathing techniques and a movement modality with an innovative curriculum to produce change is because everybody breathes, right? Everybody has access to breath. And we really want individuals to utilize this no matter where they are. So for this breath, for square breath, I do this as I'm driving sometimes if there's traffic. I do this in the grocery line. I do this if I need to take a break while I'm walking my dog. I do this while I'm watching TV. I do this breath a lot. So what it's going to look like, we're going to practice it later, but what it's going to look like is you're going to breathe in for 4. You're going to hold your breath in for 4. You're going to exhale your breath for 4. And then you're going to hold your breath out for 4. So you're going to feel that fully full sensation and that fully empty sensation. And then you'll be able to compare the two. And so as you inhale, really try to inhale in a consistent inhale for that 4 counts, and then hold that breath and be fully full for that hold. And then as you exhale, try to exhale consistently down, and then hold that breath out consistently to feel fully empty. So for this breath again, what we're trying to do, and sort of a little bit of science behind this, is we want to engage the parasympathetic nervous system. And what I mean by that is your autonomous nervous system is divided into 2 main components, the sympathetic nervous system and the parasympathetic nervous system. And that sympathetic nervous system engages that fight, or flight response, right? That fight, freeze, or flight response. And that allows us to get out of danger. And the parasympathetic nervous system is the refresh, renew, restore response, allowing us to sleep, allowing us to eat, allowing us to renew, and allowing us to become calm. And in order for us to live in this world, we do need both systems, right? We do need stressors, but we also need the chance to relax. And so these breaths are really specifically proven to engage that parasympathetic nervous system to help you decrease your pain and stress. And so for this breath, if that 4 count is really accessible for you and you want a little bit more of a challenge, or you really wanted to lengthen your exhale, you could exhale for 6 seconds as opposed to 4 seconds. And so although it's not a square and it's not even a rectangle because it's only one side that's 6 seconds long, you can actually increase that exhale, because as you increase that exhale, you're seriously tapping into the parasympathetic nervous system. So that's the first breath, square breath. The next breath is lion's breath. Now this breath is a little bit of an energy boost, if you will. You are going to inhale, but as you exhale, you're going to press the air out of your mouth intentionally, sticking out your tongue, making a noise, and maybe even crossing your eyes. I do have a story about this breath. I teach in corrections, and so I had a pretty seriously filled area that I needed to walk through. And so for me, I knew I had a lot of nerves coming on and I needed to go teach a yoga class. So I wanted to kind of not be stressed out as I walked into the class. And so this overcrowded area, I got everyone's attention and just said, let's do some lion's breath. And so we all inhaled together and we all exhaled and stuck out our tongue, and we did it 3 times. And every time I was walking through the area, every time we inhaled and exhaled, I caught a different person's attention. And so it allows you to be silly, but also allows you to accomplish something. And what are you accomplishing? You're accomplishing a way to decrease your own stress and actually to create some joy in your life by exhaling and inhaling in a new way, right? And so for us as individuals, when we're attempting to shift our feelings or emotions, this is a really good breath for us to try. And we're gonna get to try it, and we'll be able to be silly together with sticking out our tongues. Something I like to bring your attention, a lot of us are wearing masks right now. This would not necessarily be a mask breath that you could do. Pretty much the other 3 breaths that we're going to go through, so there's 4 total. The other 3 breaths that you could go through, you definitely for sure can do with a mask on. You could do this with your mask on. You just probably wouldn't want to stick out your tongue because then you get the mask on your tongue, and nobody wants that. The third breath is humming breath. And so for a humming breath, what you're going to do is really focusing on lengthening your exhale by covering your ears and making a humming sound. So you'll inhale in normally, you'll exhale and you'll make a sound, and you'll try to lengthen that exhale. This breath I use a lot. If I'm woken in the middle of the night with a night terror, I will use a hummingbird breath or humming bee breath in order to sort of help me calm my body down and to allow me to come back into a restful state. By shifting your attention and bringing your mind and your body together, because when you're triggered, and the actual trigger for somebody who has PTSD, I might physically be in my bed, but my mind is not my bed. I smell the smells, I taste the taste, I hear the sounds, I feel the sensations as if when I was attacked, right? And so although my body is in this present moment, my mind is completely somewhere else. It's in the past. And so for this breath, I'm bringing my mind and my body together, unionizing that, allowing the fear to dissipate, and really focusing on the exhale by creating a sound. And by having all those things come together, it's been proven, it's a mindfulness technique, it's been proven to help people who are dealing with extreme trauma. And so I really recommend this breath. I think it's a great way to utilize different sensations and to focus not on what's happened to you, but what you can do about it and how you can move forward into the world. The final breath is called breath of joy, and it is quite joyous. I like this breath the most to do with young kids, and the reason for that for me is it allows me to have be on the same energy playing field, if you will, as them. It might decrease their energy, but it's definitely increasing my energy, so we can come down to the same level. I am a mom. I do have a toddler child, and so if she is bouncing off the walls and needs to calm down, she'll do this to calm her energy down. And what it does for me, it kind of gives me an energy boost, which is also why this is at the end of the presentation, so that after I'm complete going through this with you, I'm not exhausted and I can actually go play with my kiddo. So for this one, I'm going to demonstrate it 2 different ways when we actually get to the demonstration portion of the class. You can do this seated, but you really can do this standing. And also, if you have any family members that are around you right now, after you do the lion's breath with me and everyone becomes silly, they might actually be interested into coming and joining you. And so this is a really great breath to kind of equalize the equilibrium, the different energy levels that you have going on in your house. And so it's a full body, awesome breath that you can do. You're going to inhale and you're going to change your arm positions as you inhale, and as you exhale, you're going to fold forward. Disclaimer. If you have high blood pressure or if you have a traumatic brain injury, please don't do this breath. You are going to be putting your head below your heart. Doing it from a chair, I'm going to show you, you won't necessarily have that full fold forward, which could cause you to have vertigo. However, if you do have vertigo, please, make sure you are seated and go a little bit slower. Again, if there's any questions about this, please do talk to your medical professional. I'm a yoga teacher. I have no idea who is end up going to be able to see this video, and so I don't want to recommend something that could potentially bring you physical harm or cause any undue stress. So breath of joy, you can do it in a chair, which is, I'm going to first demonstrate it from a chair. It's really a lot of fun if you're standing, but really be careful because you know your body better than I do. You know your body better than anyone else. And if your body tells you no, you should listen. And we just want to make sure that everyone is safe in whatever they're doing, because all we're trying to do here is help you learn ways to decrease your own stress, so you can increase your own mood and decrease your anxiety. And by allowing us to start to change the way we look at our bodies and the way that we sort of think, then we start to change our mindset. And once we can change our mindset, we can change our own behavior. And once we can change our own behavior, our outcomes are endless, right? We don't have to have these predisposition outcomes. We can instead go to where we want to go because we have the tools and the belief system, and we know that we're enough to do so. Because Yoga for Change is bringing an embodied approach to resilience. And what we mean by that is, no matter your physical trauma, no matter your mental or emotional trauma, you are strong enough to achieve your goals. It may take a little bit more work when compared to somebody else, but you can do it, and don't give up because you're worth it, right? You're worth it. And as somebody who deals with chronic pain, like I've said, and somebody who is a mom, when I get to the end of the day, I'm exhausted, right? I'm exhausted. I've given a lot of myself to other people, to my partner, to my child, to my work, to my dog, to my friends, to my family. And so when I get back and it's final end of the day, I may be exhausted. And what I found in my own life is that even though it might not be vicarious trauma, right? It might not be everything that I'm doing is potentially triggering me because of my own trauma past. There is a little bit of compassion fatigue. And for me, these breaths allow me to recharge myself, giving me the tools that I know work, because I don't want to be a burnout mom and I don't want to burn out at my job. I want to be successful and I want to continue. And these allow me to do so. So thank you for listening to our little presentation. What we're going to do now is demonstrate the 4 breaths. But before that, I want you to just kind of get to know your space wherever you are. If you're driving, please don't close your eyes throughout any of this, obviously. But if you're just sitting in your home, even though you know where the doors are and even though you know where the bathrooms are, just kind of take a look around just to feel a little bit more settled in where you are. And then maybe come to a comfortable seated position, or you can lay down on the floor on your bed, depending on what's more comfortable for you. I am right now sitting in my office in a chair with my feet on the floor. And I invite you to join me wherever you are. So if it's comfortable for you, please feel free to close your eyes or to lower your gaze or to bring your chin to your chest. And then move your shoulders back and come to what you consider a fearless spine. Maybe it's opening up your chest, shoulders back, hands on your lap, up or down, doesn't matter. And if it's comfortable for you, I invite you to close your eyes or to lower your gaze at this time. Notice your breath. Don't change or shift, just notice your breath. Notice how the air comes into your nostrils and how it exits your nostrils or your mouth. If your tongue is jammed onto the palate of your top of your mouth, let your tongue fall to the bottom jaw. If you start to slump forward, really pull your shoulders onto your back. Create, again, a fearless spine. Now bring your hands to whatever parts of your body are potentially giving you pain. For me, it's just right now my shoulders. Maybe you touch your shoulder and just touch where your body feels pain. There's your feet. If you're on your bed, press your heels into the bed. If you are sitting in a chair, press your feet into the floor. If you're standing, press your feet to the floor, wherever you are. Lengthen your spine. Create space between all the vertebrae down your back, pressing your head up towards the ceiling or the head of the bed, pressing your feet down either towards the floor or into the bed, whatever is more comfortable for you. And now notice maybe the pain or sensation or friction in your body has shifted. So maybe it's the same, so leave your hands there. Maybe it's shifted, so shift your hands to a different position, allowing your body just to breathe itself. Take 3 more breaths wherever you are. Drop your hand back to your lap. Maybe choose to open your eyes if they're not open, and everybody together across the world, wherever you are, exhale. Awesome. So we're going to start with square breath. Just to again quickly review, we're going to inhale for 4. We're going to hold our breath for 4. We're going to exhale for 4, and we're going to hold our breath out for 4, creating a square. Okay, so take a normal, unrestricted breath in, and a normal, unrestricted breath out. And begin. Inhale, 1, 2, 3, 4, hold. Exhale, 1, 2, 3, 4, hold it out. Inhale, 1, 2, 3, 4, hold. Exhale, 1, 2, 3, 4, hold. 2 more times. Inhale, 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 hold. Exhale, 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 hold. In breath, in breath, in breath, in breath, hold. Out breath, out breath, out breath, out breath, hold. Allow yourself to breathe in normally and exhale normally. Take an inventory. How do you feel? Do you feel more settled in your body? Do you feel more pain or less pain? Do you feel happy or sad? Like, just notice what that breath created for you. Take a normal breath in and exhale. Awesome. Lion's breath. Okay, so again, you're going to inhale in through your nose or mouth, whatever is comfortable for you. You're going to exhale, stick out your tongue, exhale, and maybe you make a sound, maybe you cross your eyes. What do you need right now, right? And this is silly, so get silly with it, right? Because I'm feeling silly, I'm by myself. If you're by yourself, be extra silly. If you're not by yourself, be extra silly. If people are looking at you, invite them to do it with you, right? Because nobody wants to be silly by themselves. So let's pretend we're in together a room and we're just being silly together, and we're going to take a breath in and exhale through your mouth, stick our tongue. Inhale. Exhale. Inhale. Inhale. Last one, in. Inhale. Normal exhale. What do you feel? I feel a little tingling in my neck and my hands. I feel a little more energy. I feel energized, and at the same time, I feel grounded, right? Notice, do you feel pain? Where do you feel pain? Do you feel pain in the same place? Is it a different kind of pain? Just notice, right? Just notice. No judgment here. We're just noticing. And by noticing, we're allowing ourselves to allow the pain to be okay, to notice it for a certain amount of time, and then to stop noticing it and moving into something else. And the only way to do that is by really bringing our mind and body together, but really allowing the pain to live when it needs to live, and then to try to close it off when we need to move on to something else. At least that's what I do, and it seems to work for me. And one of the breathing techniques that I do specifically when that is going on is humming bee breath. And so what we're going to do is you're going to use your index finger alone if you have that. I personally like to use 2 fingers just to make sure that my ear hole is really closed. You're going to inhale in and you're going to hum out. Now I'm going to hum out for a long time, not as long as I normally go for, but long enough so that you can see that you really need to hum and slowly hum your breath out, right? Because for the 4 count breath, the square breath, we're inhaling consistently for 4, feeling that full feeling for 4, exhaling consistently for 4, and then emptying out. This one we want to inhale and then exhale as long and slow as possible, okay? Great. Okay, so take a normal breath in and an uncontrolled out. Let it go. Take your index fingers and your third fingers, cover your ears, inhale. Exhale, hum. Inhale. Exhale. Inhale. Exhale, hum. Last one, inhale. Exhale. Normal breath in. Long, slow exhale out. Fantastic. What do you feel? Do you feel a lot of buzzing in your head? Are you still hearing your own humming voice? What do you feel? Do you feel pain? Just notice, right? That's all we're doing. You're just noticing, a little bit of inquiry, just trying to learn ways to decrease our own pain so that we can focus on whatever we need to focus on in that given moment. So the final breath, again, like I said, is breath of joy. You can do this from a chair. You can also do this standing up. It's an inhale, a 3-part inhale, and a very long exhale. So you'll inhale your hands forward, inhale your hands to the side, inhale your hands up to the sky, exhale, fold forward. So we're going to do it first in a chair, and then I'm going to stand up and demo it so you can see it demoed standing up. So inhale your hands up, 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 out, up, 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 out, up, 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 out, in, out. Last one, in, out. Slowly sit back up. Now you can stay seated and do it again, or you could try to stand up. Again, if you have high blood pressure or you have a traumatic brain injury, please do not do this without talking to your doctors first. I am a yoga teacher. I am not a healthcare professional. I try to stay in my own lane. I just know it works for me. And this breath works a lot for me if I'm trying to decrease my daughter's energy level by bringing my own energy level up. It's fun. It's family friendly. You need to have enough room where you can bend over without hitting your head on a desk or potentially hitting a bookshelf, right? So just notice where you are in your own space, and then we'll do it together. So you're going to inhale your hands up, 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 exhale, up, 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 exhale, inhale, 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 exhale, inhale, 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 exhale. Last one, in, out, and slowly rise up. Awesome. Now what I've also done for this is I've gone quicker, right? So you can go as quickly as you want as you fly through it, or you can go slow and controlled. So whatever your body needs, you're going to do that, okay? But as a way to show you kind of how I've done it, I'm going to turn to the side and sort of like imagine we're in a kindergarten class or not, right? Just imagine your own life. Maybe your life is a kindergarten class of everybody, a lot of energy and movement, and we want to kind of bring everything together. So you inhale your hands up. Last one. As you stand up, notice what you feel, right? Maybe that was too fast, and that's okay. I was just showing the diversity of how you can go a little bit slower and also a little bit faster based on your pain, based on your life and what's good for you. But you can tailor these breaths for your own life. And so we've gone through 4 specific breaths: square breath, lion's breath, bee breath, and also breath of joy. And so I invite you to check out more resources on the Yoga for Change YouTube station. More information can be found on www.y4c.org. That's the letter Y, the number 4, the letter C.org. Thank you to PAMI for allowing us the opportunity to spend some time with you as a patient or as a caregiver. I wish you joy and peace during this time and hope you have a fantastic rest of your day. Thank you so much.